Reducing the use of supporting devices is a major step towards achieving maximum independence for the prosthesis wearer. Learning the correct walking technique plays a key role in this process. Depending on the mobility grade, the patient should first learn the 4-point gait with assistive devices such as crutches, and then the 2-point gait with no support devices. Visual coordination aids can be very helpful for this. The use of support devices is gradually reduced. During this process, the user learns to pull more weight on the prosthesis while the torso assumes the stabilizing function which was previously performed by the arms. As a result, the patient's body posture improves and a more harmonious gait pattern is achieved. In addition to learning the proper walking technique, the patient should complete the strengthening exercises described in the following section at regular intervals. Once the swing phase can be initiated reliably, this is practiced during unsupported walking. In order to raise the level of difficulty, the patient should walk in a circle or a figure of 8 while initiating the swing phase on the outside and on the inside of a turn respectively. In order to develop a physiological stride length and stride width, and therefore a more harmonious gait pattern, positioning footprints on the floor with spacing adapted to the amputee is recommended. The amputee tries to step on the footprints. In doing so, hitting the target by drawing up the contralateral heel must be avoided. The patient should not focus on the footprints for too long during this exercise and should keep the upper body upright and the gaze straight ahead while walking. This exercise can be completed between parallel bars and later also during unsupported walking. In order to make this exercise more challenging, the height of the footprints and the materials that are used can be varied. This allows the amputee to practice walking on various surfaces indoors in preparation for walking on uneven terrain outdoors. Physiological flexing of the knee joint under load is possible with the C-leg. However, many patients avoid this natural and important movement. The therapist should guide the C-leg during the first few steps in order to help the patient learn this function. In order to do so, the therapist places one hand at the top and in front of the knee and the other hand on the back of the pelvis. At a knee flexion angle of approximately 10 degrees, the hand on the knee joint is pushed backwards and the hand on the pelvis is pushed forwards. This facilitates flexion under load. Once the movement pattern has been internalized, repeating this exercise without the aid of support devices is recommended. Using a metronome may be helpful in order to achieve a symmetrical distribution of the stance phase duration. The therapist can set the rhythm in order to specify various walking speeds for the patient. Changes in the walking speed are required during everyday life, for example when crossing a street, catching the bus, or while window shopping. Such speed changes are possible with the C-leg.